Today, we're going to talk about Senna S, a medication used to treat constipation. It contains two medications, Senasides and Docusate. Senasides are stimulant laxatives that work by keeping water in the intestines, helping to cause movement. Docusate is a stool softener that increases the amount of water in the stool, making it softer and easier to pass. It's important to take Senna S as directed by your healthcare provider. The usual dosage for adults is 1 to 2 tablets once daily, taken at bedtime or as directed. Always follow the instructions on the label and check with your doctor for the best time to take this medication. When taking Senna S, it is important to follow the dosage instructions provided by your doctor or on the product package. Typically, it is taken by mouth with a full glass of water. The dosage will depend on your age, medical condition, and how you respond to the treatment. It's important not to take more than the recommended dose or use this medication for more than 7 days unless directed by your doctor. Keep in mind that it may take 6 to 12 hours before Senna S causes a bowel movement. If your condition persists or worsens, or if you experience rectal bleeding, it's important to consult your doctor. And if you suspect a serious medical issue, seek medical help immediately. If you experience stomach pain, nausea, diarrhea, or weakness while taking Senna S, let your doctor know. This medication may cause your urine to turn reddish-brown, but it's harmless and will go away when you stop taking the medication. Your doctor has determined that the benefits of using Senna S outweigh the potential side effects. Most people who use this medication do not experience serious side effects, but you should contact your doctor if you have persistent nausea, vomiting, diarrhea, muscle cramps, irregular heartbeat, dizziness, decreased urination, or changes in mental/mood. While rare, a serious allergic reaction to Senna S is possible. Seek medical help immediately if you experience a rash, itching, swelling, severe dizziness, or trouble breathing. This is not a complete list of potential side effects. If you notice any other effects, contact your doctor or pharmacist. Before taking Senna S, it's important to talk to your doctor or pharmacist if you're allergic to Senna, Senasides, or Docusate, or if you have any other allergies. This product may contain inactive ingredients that can cause allergic reactions or other problems, so it's important to get more details from your pharmacist. Before using this medication, make sure to tell your doctor or pharmacist about your medical history, especially if you have had appendicitis or symptoms of appendicitis, a sudden change in bowel habits lasting longer than 2 weeks, bleeding from the rectum, or intestinal blockage. If you are planning to have surgery, it's important to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, it's important to consult your doctor before using this medication, as using it for long periods during pregnancy is not recommended. This medication can pass into breast milk, but it is unlikely to harm a nursing infant. Make sure to consult your doctor before breastfeeding while using Senna S. It's important to be aware of potential drug interactions when taking Senna S. This can affect how your medications work and may increase the risk of serious side effects. It's recommended to keep a list of all the products you use and share it with your doctor and pharmacist, including prescription/non-prescription drugs and herbal products. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. One product that may interact with Senna S is mineral oil. Always consult with your healthcare provider before taking Senna S to ensure it is safe for you. If you or someone you know has overdosed on Senna S and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, you can call a provincial poison control center. Symptoms of overdose may include persistent nausea, vomiting, or diarrhea, as well as severe stomach or abdominal pain. It's crucial to address these symptoms promptly to ensure safety and well-being. Make sure to keep all of your medical and lab appointments. In addition to taking Senna S, there are some lifestyle changes you can make to prevent or relieve constipation. These include exercising, staying hydrated by drinking enough water, and maintaining a proper diet with fiber-rich foods such as bran, fresh fruits, and vegetables. If you have any questions about lifestyle changes that might benefit you, be sure to talk to your doctor or pharmacist. And remember to always follow your healthcare professional's instructions for taking Senna S. If you are instructed to take Senna S on a regular basis and you happen to miss a dose, take it as soon as you remember. However, if it is close to the time for your next dose, it is best to skip the missed dose and continue with your regular dosing schedule. Do not take a double dose to make up for the missed one. When it comes to storing Senna S, it's important to follow the specific instructions provided on the product package or from your pharmacist. Keep all medications out of reach of children and pets to ensure their safety. And when it comes to disposing of Senna S, make sure to properly discard it when it's expired or no longer needed. Consult your pharmacist or local waste disposal company for the best way to do this. Remember, never flush medications down the toilet or pour them into a drain unless specifically instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.